I've always looked at it as the 3 Ps, and that's what we talk about in our organization. To be present, to be prepared, and to be prophetic. So what do I mean by that? First, be present. It's something I think we can learn from our colleagues in chaplaincy. They talk about this concept of ministry of presence. And in some ways, that's what the mission leader needs to do also. They need to be present. Look at all the different dynamics of a mission leader. They're in the boardroom, the executive leadership table. You need to be present. You need to be at the table. You need to be engaged in those conversations. You need to be involved in operations and strategy and finance and all of that. It also means to be prepared. If we're going to be in those areas, we need to be prepared and ready to engage them. If we're going to be talking with clinicians about ethical pastoral care of patients, we need to be aware of the current contemporary clinical issues, the medical issues that we're facing as a healthcare entity. So we need to be prepared in that knowledge. If we're going to be engaging with our partners on strategy and operations or finance, we need to speak their language. And then finally, we need to be prophetic. As we're engaging in those conversations, we need to be able to, with that training that we have, speak a certain prophetic wisdom. This does not mean now that the mission leader somehow has all the answers and I'm going to tell you what to do, but rather it invites us to get into the messiness of life. Look at the great prophets of Scripture, for example. They didn't just come down a mountain and proclaim. They were with their people. They were in the messiness of life. They were in the struggles that their people went through, but prophesied a message that God is with you. So as mission leaders, in the messiness of life, as we are present to people in all of that, we can speak a message, God is with us. And what is God inviting us to do in this clinical situation, in this strategic conversation, in this outreach to the community, whatever it might be? So be present, be prepared, and be prophetic. The 3 Ps are what I would suggest mission leaders be attended to.